This case is titled Multilocular-Solid, Vascularized Mature Cystic Teratoma. This was a case of an 18-year-old nulliparous widow who presented the history of abdominal mass, and on examination the mass was found to be equivalent to 34 weeks gestation. Ultrasound revealed a multilocular solid lesion with a color score of 2. This paper, published March 2022 in the White Journal, is about the largest series that looked at the clinical and ultrasound characteristics of ovarian mature cystic teratomas. In this paper, they found only 8.7% of mature cystic teratomas that manifested vascularized solid tissue. And out of this, 7 did not exhibit the typical features of mature cystic teratoma. So these are the still images of this 18-year-old nulliparous widow. This is the transvaginal image. As you can see, the whole area here is taken up by a multilocular solid lesion, and the solid component here has taken up color on this HD floor and on power Doppler here on this transabdominal image. This is the rendered image, and this is the HD flow of the vascular supply to the solid component of this mature cystic teratoma. And this is also another display using a different glass body mode. Again, this is the transvaginal image showing clearly the ovary here with the cysts, not the peripheral location of these antral follicles, and the thick stroma. If you look at this area, appears like a crescent. This is called the crescent sign, and this suggests that this lesion is intra-ovarian. So this should not be mistaken for a para-ovarian lesion. Secondly, there's a clear line of cleavage between the cyst and the ovarian substance, and the surgeon was informed that this ovary can be conserved, and the ovary was actually conserved. These are transabdominal images of the same patient. Here you can see this lesion with extensive shadowing. Surgeon cannot make out what is around this area. Note that the uterus is pushed up and it's just underneath the peritoneum here. Here one can see the uterus here, and again you can see a clear demarcation between the cyst and the uterus, suggesting that there are no adhesions. The surgeon was again informed about this, and there are no adhesions at surgery. Here, not this area of calcification and the tip of the iceberg sign. Here again, look at the multilocular solid lesion with bright lines and dots. Bright lines and dots with extensive shadowing. Again, here, note the content of the cyst and the multilocular solid nature with extensive shadowing. Now let's look at the video of this case. Here is the bladder. This is the uterus. You can see the uterus is stretched out by the tumor and not the clear demarcation between the ovarian cyst and the uterus, suggesting that there are no adhesions. Here, look at the cyst sitting just beneath the anterior abdominal wall. Not these echogenic spicules within what looks like ground glass appearance. These echogenic specks represent the bright lines. Here again, look at some bright lines and dots representing here, not the multilocular solid lesion. And the extensive shadowing. Look at the extensive shadowing. All these are classic features of mature cystic teratoma. She had surgery, not the ovarian cysts and the normal contralateral ovary. This picture was obtained at the histopathology laboratory with the cut surface showing the multilocular solid nature of the lesion. The histopathologist received an open cyst measuring 17 by 10 by 10 centimeters. Further opening revealed multilocular cysts containing a solid area that has multiple cysts and is slimy. There was focal grittiness on cutting. Tissue is composed of heterogeneous elements made up of skin and skin adnexal glands, mature neural tissue, respiratory tissue, adipocytes, cartilage, and gastrointestinal glands. Features are consistent with mature cystic teratoma.